there has to be, can you think of a story that was that, or like a situation where you felt like it was rewarding or like fulfilling?
Yeah, that wall, to touch on that, one of actually the same attending that I was talking about a couple of minutes ago, she's one of the docs that sees these patients in clinic. And that was her idea.
That's
She was
cool.
like, I think this would be really helpful for staff members
Yeah.
because for us, like, we get them to, if they survive their acute illness, they go to the acute care side. And then, we don't ever discharge patients from the ICU. It's like very, very
Yeah.
rare.
Yeah.
So we weren't really, we were like, yay, they go to acute care, but we weren't really seeing the like after effects of it. And I think a lot of us were struggling and not
Yeah.
knowing like, how are they doing?
Right.
And so that was her idea, was to take pictures with patients' permission, and then they've gotten updated. Like there's pictures like behind some of the newer pictures.
Yeah.
Yeah.
So cool.
Seeing the first patient that I ever intubated on that wall, that is probably the most like rewarding, or like it's a really great, it's hard to explain. Seeing her up there was the coolest thing ever because she looks so normal.
Yeah.
So that was when, at our hospital, we were fortunate where, we had an addition that just got put on to the hospital, like this huge addition, increasing our bed size by like, I don't even know how many. But the units weren't filled yet. So once, we realized we were going to be getting more patients, we actually moved from like the regular MICU to a separate unit. But
building.
Before that, we were
completely separate building.
Oh gosh, it's like completely different buildings. You got to walk them, forever to get back to the old MICU, we call it MICU proper. And when we were on, the MICU we had kind of separated our MICU patients from COVID patients. My first patient that I helped intubate was on acute care, which they're connected to the regular MICU. And she like completely decompensated right before shift change on night shift. And I went out and they decided, we weren't sure with the aerosolization of the virus, like, could we safely bring her? We didn't really know what we could do.
Yeah.
So I intubated her on the acute care floor. I helped intubate her. And we transported her back to the MICU, and I helped prone her that night. And she was my first intubation, my first prone, my first COVID positive patient that I was actually in her room. So seeing her photo up there, like nothing brings me more joy than seeing that and being like, we can do it,
That's got to be
it
one of
brings
the
hope.